You've probably heard someone say the expression that they are double jointed, when what they really mean is that their joints are hypermobile. So in this video, I'm going to provide tips on exercising if you are extremely flexible. Hi everyone, and welcome to Exercise for Health. I'm Richard, and today I'm going to provide tips for exercising if you have hypermobility. If you're new to this channel, we offer tips, advice and exercises each week to help you manage your health condition with physical activity. So go ahead and tap the subscribe button below and the bell icon if you want to be notified of when we upload a new video. The term hypermobility means that either the joints have more laxity due to the extra give in the ligaments providing an increased range of movement, or that the muscles around the joint are less sensitive to the stretch reflex, a neuromuscular response to contract the muscles as they are being lengthened or stretched. In most cases, genetics play a big role as to whether you are hypermobile or not, but there are health conditions that can present hypermobility as a symptom, which I'll place up on screen now. It's also worth noting that pregnant women can also become hypermobile as the hormone relaxin is produced in greater quantities, particularly during the first trimester. If you have other symptoms alongside your hypermobility, including joint pain, extreme tiredness, frequent stiffness symptoms, you often get sprains or strains, your joints keep dislocating or pop out, you have thin stretchy skin, or you have bowel or bladder problems, then you may be suffering with joint hypermobility syndrome. This generally affects children and young people and often gets better as you get older. There is a clinical test that physios and doctors can carry out to determine whether you have hypermobility or not, and it's called the Bayton Test. This involves being asked to perform 9 different positions of the joints in the little finger on each hand, the thumb on each hand, the elbow on each arm, the knee on each leg, and in the spine. If you're able to attain the position required, you get a score of 1, and if your overall score for all 9 positions is 5 or more, then you're considered to have hypermobility. In most cases, people with hypermobility feel as though their body isn't quite as stable as it should be, and they may feel anxious about exercising or taking part in sports that may increase the risk of dislocation. Although they may be more flexible, they won't have as much stability or control over the movement of the joint. So providing there isn't one of the underlying health conditions present that I put up on screen earlier in this video, here are my tips for safely taking part in sport, exercise and physical activity. You can do any type of physical activity in the sense that you're not restricted from participating in anything. However, be careful not to carry out movements that place your joints through an extreme or uncontrolled range of movement. An example would be throwing activities like baseball. The movement can place a huge amount of explosive force through an extreme range of movement in the shoulder. If your shoulder stability has not been conditioned through periods of strength training first before taking part in this type of activity, then you're likely to increase the risk of joint dislocation. Aim to improve your joint stability by strength training within your joint's normal range of movement, so without going to an extreme ranges that you might be able to, also known as hyperextending. To start, you can perform isometric exercises like a static squat, high plank, body hang or one-leg stands, where you hold your body in a position that isn't taking the joint through its end range of movement, so that you need to activate the muscles around the joint to stay still in that position for 30 seconds to a minute. Stimulating the muscles near their end range can greatly improve joint stability and will train the brain to stay within the normal range of motion during a variety of movements and day-to-day activities. You can then progress these exercises to include some controlled dynamic movements without going to an extreme range, such as squats, press-ups, pull-ups, or Romanian deadlifts. Performing these slowly, especially when lowering your weight while your muscles are lengthening under tension, is crucial so you can control the range of movement under load. Performing balance exercises to stimulate the core muscles and the smaller muscles around the joints can be really effective at improving joint stability, so your skeleton becomes a stronger unit. This can include using balance boards, gym balls, stability discs, and even household sports balls. Again, however you use them, just make sure your joints don't go to that extreme range of movement. If you haven't been exercising for a while or you have led a sedentary lifestyle, then starting out with lower impact activities may be more appropriate for you. Taking part in cycling or swimming can be really effective initially in building strength around the joints without placing them under too much stress. And swimming in particular can be really helpful as you can work against the resistance of the water, so you're less likely to have an injury. Although stretching will be okay, it isn't as important to managing hypermobility as strength exercises are. Although you may not feel pain or discomfort taking your joint through to its end range, it's important to understand that you need to have strength and control at every part through that range of movement. However, stretching muscles that restrict your range of movement, if you have an imbalance in the body, may be beneficial. For example, if your hamstrings are very flexible and you can easily touch your toes with your legs straight, try bringing the heel of one foot up towards your bottom to see if the quadricep muscles on the front of the thigh feel tighter by comparison. This will indicate that you need to strengthen the hamstrings and stretch the quads to improve the body's balance. I hope you can take something away from this video today. If so, please give it a like by clicking the thumbs up button below to help this channel grow so more people can benefit from it. Thank you so much for watching, and remember to stay active, keep moving, and I'll see you next week. Thank you for watching. If you enjoyed this video today, please give it a thumbs up. You can also click here to subscribe to this channel or click here to watch a recent video. See you soon.